My name is Analeta Peterson. I'm a board certified OBGYN, and let's talk briefly about heavy menstrual periods. So, I wish I could tell you guys how many times I've had to take care of a woman who comes into the emergency room. She's been bleeding for weeks, and finally she either passes out, she's too weak to walk, or she's just sick and tired of bleeding. And she comes into the emergency room, and guess what? She is severely anemic and needs blood transfusions. In some cases, we are even surprised that the person even made it to the emergency room because their blood counts are so low, it seems like they would be dead. So don't let this happen to you. If you are having a heavy menstrual period and it's been going on for over 10 days, that's abnormal, and that's the time when you need to call your doctor. Don't wait and see. A lot of women say, oh, well, I thought it was going to stop, or it kind of slowed down and then it picked back up, and I just figured it would stop. Well, by day 10, if you're still bleeding and it's very heavy, that's the day to call the doctor for an appointment. Don't wait until day 14, day 21, and then you end up needing a blood transfusion that could have been avoided. So, as many of you probably know, heavy menstrual bleeding is considered to be problematic if you are using maybe a regular size pad or regular size tampon, supersized tampons, or very large pads, overnight pads. If you are soaking those every hour or less than an hour, and that's been going on for 3 or 4 hours, that's not normal. If you're losing that amount of blood, over time, you are going to lose so much that you probably will need to go into the emergency room. If that happens on even one day, you need to go into the emergency room that day, especially if you're starting to feel tired and weak. So if you're soaking regular size, super size tampons or pads every hour for 2 or 3 hours, call your doctor right then or go into the emergency room. This really can be life or death. And even if it's not life or death, who wants to be in the emergency room for hours at a time receiving a blood transfusion? That's just not what you want, especially for women who have this problem throughout their life. They're constantly going into the emergency room with this problem. At that point, you need to make some decisions. You need to make an appointment with the doctor, come up with a plan so that you can end that cycle right here and right now. So that's just my bit of advice. Just know that over 10 days of bleeding is too long. Changing your pad every hour for 4 to 5 hours in a day is too much bleeding. And feeling tired or extremely fatigued during your menstrual cycle is likely a sign that you are bleeding too much. Don't wait until it's too late to get this taken care of. This is something that can be treated with medication. In most cases, you can avoid surgery and you can avoid a blood transfusion.